Gastroesophageal reflux disease or GRD is a very common ailment which affects a large number of people. Commonly we refer to it as acidity or acid indigestion or simply indigestion, and there are so many other names. Now, in a normal individual, between the food pipe and the stomach, there is a wall or a gate. Now, the main function of this valve is that it allows the food from the food pipe to go into the stomach, but does not allow the contents of the stomach to come up. But sometimes the contents of the stomach, like food and the acid, can come up into the food pipe, and this is what we call as gastroesophageal reflux. Now, this reflux may then give rise to certain symptoms and complications when we refer it as gastroesophageal reflux disease. Now, the common symptoms of reflux disease, the most common symptom is heartburn. And heartburn is basically a feeling of burning sensation behind the center of your chest, behind the center bone. Then the other symptoms are the patient can have chest pain, the person can have pain in the upper abdomen, the patient can have sour eructations or feeling of bitter taste in the mouth. But besides these typical symptoms, there can be certain atypical symptoms also, which includes a feeling of chronic cough, a feeling of repeatedly clearing the throat, a feeling of lump in the throat, hoarseness of voice, and sometimes even asthma-like symptoms can be there because of reflux disease. Now, if one has reflux disease, there are certain lifestyle modifications which can be done to control your symptoms, and these include, first of all, dietary regulation. There are certain foods which impair with the functioning of this valve and they can cause more of reflux, or they can foods which produce more acid, they can cause more reflux. And these foods include things like chocolate, peppermint, spicy food, citrus drinks. All these can cause increase in symptoms of reflux disease. So one should avoid this if one has a GERD. Other things which should be avoided include alcohol. Alcohol causes a lot of reflux and impairs with the functioning of your lower esophageal sphincter. Then cigarette smoking also can cause a lot of reflux-like symptoms. So these are the things which can be avoided. Overweight or obesity is associated with GERD very commonly, and if a person reduces weight, then the symptoms of GERD may be much better. The timing of the food, eating your dinner, and the sleep, the bedtime, this is very important. Normally there should be a gap of more than 2 to 3 hours